Hi,
Hi, how are you?
I'm doing great. How are you?
Good.
You look so put together, like you've been going to work and
Uh,
like in an office.
no, I have to go in every so often, but next week I'm actually in the hospital. So
Okay, is this your first time doing clinical rotations since it all began?
no, we've been going in to volunteer to test people. It's obviously slowed down quite a bit in Nashville, so we're not needing to volunteer as much. Um, so now it's just making the kids get their homework done and all that stuff.
Yeah,
How are you?
I'm doing well. My kids are in the other room as well, so you might
Okay.
hear like jumping and stomping.
Well, I know I had to tell them before I came on. I was like, guys, in fact, I left. Otherwise, it's chaotic. You just, and then people running by just to sort of see who's there.
Right, yeah, yeah. It is madness. But thanks so much for taking the time to talk to me.
Yeah.
It'll be brief, but we'd love to learn a little bit about how you're spending your days and what we're learning about the coronavirus, because we've got followers on our social media who are physicians in the US that are curious to learn some of the science behind it, as well as frontline health workers in the developing world that you've spoken with in places like Kenya and Cameroon, who
Yeah.
might be interested to know what they can do with limited resources. So, we'll just start off by saying, what do you know?
Yeah. So, we know that this virus is very infectious. I think that's the one thing that we want. And I think the whole world is starting to appreciate that. It's very infectious. Part of it is the virus replicates really easily in the nasal areas and also in the mouth. And it's easily transmitted even without somebody feeling unwell. And so typically when you think about other viruses or the flu, people are generally not well. And because of that, they will either avoid other people or be more careful to not transmit it. The problem with COVID-19 is people are walking around not knowing that they're infectious. And thankfully for them, they don't get really sick. But the problem is then you see one person get sick in a household and everybody else in that household or in a meeting or in a church congregation or who went out for Mardi Gras many people get infected just because it's easily transmitted because people just don't know that somebody's infected.
And so across cultures, I also feel like that's something that confuses a lot of people. And it
Yeah,
even breeds some conspiracy theorists who say that it's just not real.
yeah.
And I think what we want to know is, what's the science behind this? How did this begin? I mean, did it really start from someone who ate a bat in Wuhan, China? Or I've read other places where it's very similar to the SARS uh, infectious disease that occurred many years ago during the Obama administration. But is this something that has been building and has been breeding around the world?
No, I don't think so. I mean, I think recently there's maybe a report about one lab that might have had this virus. I don't know. I cannot speak to that because I think we're just starting to hear that potential source. But this virus infects bats, and typically in a bat, so you have viruses in other animals that will infect them, and we live close to these animals, and they don't affect us. But it looks like this virus was able to go from a bat to a small primate, and then possibly from an infected primate was it changed enough that it was able to infect a human. So unlike other viruses, where some people have previously been infected and they have immunity, nobody in this world it's a new virus, so nobody had been infected with this virus before late 2019. And then once it got one or two humans infected, the virus had changed enough that it's able to replicate effectively in humans. And unlike other viruses, it looks like it doesn't take a lot of virus to infect one individual from another. So it's not an airborne um, in transmission. It's transmitted by large enough droplets. And that's why social distancing works. But if you have people in close proximity, either hugging or sharing cups, the virus is easily transmitted and it's infecting other individuals. Unlike the flu where we get vaccines, because nobody has any antibodies or T cells that can fight this infection, everybody who who gets close enough to somebody who's infected, we will get the virus. Now, how sick they get just depends on other things, how good the immune system is, and that's why we're talking about comorbidities. But anybody who gets close enough contact with somebody who has an infection will get it. Now, once we have people who are immune and we have vaccines, then you have this, what you hear people calling herd immunity. Herd immunity means that if you have a room of 10 people, and 5 of them have been immune to or have antibodies to a certain virus, even if they got infected, the virus does not replicate to where there's enough virus, that potentially the other 5 people in the room might be okay and not necessarily get infected if the virus came in and actually got into somebody who already had immunity to it, just because it's not able to effectively divide and cause disease in that person so that they infect somebody else. Does that make sense?
Yeah, that makes sense. And I want to go back. You mentioned comorbidities, which
Yeah,
highlights something that's more social
yeah,
within this pandemic, and that is that there are people who might experience life much different from you and I. They do have different health indicators that are worse off than us, and a lot of that's linked to poverty
yes.
and different socio-geographic areas of the world. So the Addis clinics work primarily in Africa, I think could be really important in the future as we see inequality exacerbates the spread of this disease and potentially the most harmful consequences of this disease. So could you just talk about someone who does have a comorbidity, like you consulted on a case for us earlier this year, a patient who may have had tuberculosis, may have had cancer, but because of testing limitations, you didn't know. So, what would happen to that person if they were to catch one of the most severe cases or strains of this virus?
So they might not make it, especially so for our patients with HIV, we don't know yet that, especially if they are on antiretrovirals, if their CD4 count is fine, we're still telling them take extra precautions. But unlike high blood pressure or diabetes or lung disease, which many of our patients have anyway, for those we know for sure those have been shown. For our patients with HIV, the jury is still out, but we're telling them to take extra precautions. But like the case we were discussing where we had a young man who had AIDS and no CD4 T cell counts, they would be at risk. So anyone who's immunosuppressed, and our cancer patients here, we're finding that are really susceptible to the disease. And for those who get it, I mean, many of them die with overwhelming disease.
Mm.
So I think for those patients, what we're telling them is, especially because right now, we don't have any drug that we know for sure works. Even the hydroxychloroquine, there are clinical trials that are being done, and they're being used in that setting, but we don't yet have enough data to even say everybody takes this as prophylaxis or everybody should take this. So the one thing that, Dr. Fauci and everybody else has been pushing is wash your hands, social distancing, and just self-isolating, especially if you're at high risk, until we have better solutions, is the best advice that we could give them. In resource limited settings where people are living in slums and you have 10 individuals in a home and 5 of them have to go out so that they have something to eat, it's really hard to say. And so I'm nervous about how Africa will play out so far. Um, if what we're getting in the reports is accurate, it looks like it hasn't caught up yet, and they're not they're not in the exponential phase, but it's nerve-wracking.
Right. And what we see on most international news programs are the slums in African countries. But I think it's important for people to realize that there are also middle and upper class neighborhoods
Yes.
in countries like Kenya as well. It's just not a monolith. Their health system is stronger than some neighboring countries, but it's still not. No, I don't think any health system is strong enough to deal with something like this, and the aggressive pace with which it spread. But what are some things that you're learning at Vanderbilt on how to treat and suppress the spread of this vaccine within patients?
So the number one thing has been the social distancing and people staying home to sort of mitigate the risk. So by people staying home and actually not being in a place where they can get infected, such as what happened in Louisiana, I think that has been the most effective thing to reduce the spread and to sort of flatten the curve as you've had people talk about. When people get sick, majority of people will get well on their own. So self-isolating, self-quarantining, washing their hands effectively, and just taking care of themselves, if it's Tylenol and fluids and rest, so that, number one, just limiting the spread from those individuals. Those people who get hospitalized because they're really sick, we have different clinical trials that are going on at Vanderbilt with the Ebola drug that has been repurposed, which is the remdesivir, and then with the hydroxychloroquine. We are treating patients with these drugs, but in clinical trials, because we don't know that they work. Now, the one thing that we know works is early intubation and just really good respiratory care. That seems to work really well for patients. And so Vanderbilt, I think among other institutions, has realized this. And so we're not waiting too long to help support patients who look like they're not doing well. And it seems to be improving outcomes for patients in terms of doing better. But like many people are saying, this is a new virus. We're learning as we go. I mean, we were meeting every day, now less often, to just review publications from China or France or Italy to see what they did, from talking to our colleagues in Seattle and seeing what they're doing. Because there are other drugs that we use as well if patients get really sick. But again, it's in clinical trial settings and just trying to learn as we go.
And you mentioned good respiratory care, since this does affect the lungs
Yes.
most acutely. What are some good tips for people in everyday life? I mean, it sounds like social distancing, self-quarantining, that can occur across countries, across cultures, no problem. It seems like there might be some good respiratory care and precautions that people can do as well in Kenya, Cameroon, or the US, like smoking cessation, for instance. What are some other tips like that?
So definitely smoking cessation, I think, is really important. I think if people are able to get some form of exercise in any capacity while being able to social distance, that always helps as well, because, you get your lungs to expand as much as they can. And, you're just in a better position if you got the infection to do well. I think anything else after, along with the stop smoking, of course, if you're vaping, stop vaping if you can. Anything else that happens after that is in the setting of an infection would be, just, giving them supplemental oxygen if needed early. And if they get really sick to where they're going to the ICU, then the ventilator care is what I was talking about.
Yeah. Yeah. Well, that's terrific advice. And hopefully that will be useful for all of our followers across social media. They are clinical officers and nurses who are on the front lines. And because of a lack of testing in the developing world, which is the same as here in Tennessee and around the United States, we don't quite know when the peak will occur in the developing world. But it seems like we're in for what could be a very protracted fight with this illness worldwide. Is that fair?
I think that's fair. And I think that's where, having the Addis clinic is great, because I think it's an infrastructure that's been set up so that we can hopefully actually know from the clinical officers in remote areas what is happening and what their needs are. Because I think without that, that infrastructure was otherwise missing. What's happened in a lot of these countries is that they've stopped the urban to rural travel, which is one way of reducing the risk of spread, so that if it's in the bigger cities, that they take care of it. Obviously, for our healthcare workers, them protecting themselves as much as when they're caring for patients, which is using some sort of PPE, even if it's homemade PPEs, if they don't have airborne masks. And the airborne, the N95 masks are more helpful for if they're doing procedures, but otherwise the droplet masks will help. And so just taking extra precaution to have gloves on if they can, put on the droplet masks or airborne masks if they're doing any procedures, wearing any form of gowns while they're caring for patients, so that they're also not the vector that's spreading the infection. And if everybody can behave like they have that infection to try to minimize spread to other people, that would be the most important thing. If you're poor and you have nothing to feed your family, that becomes an issue. And so I think if the governments are able to focus just on those groups and help them within this time period, like what's happening here with people getting stimulus checks, that helps quite a bit. And in terms of, if you're going to tell people to stay home, they need to have a way to be able to fend for their family, then they will stay home. And so as this virus, as we sort of see what the virus does in Africa and in other countries, we're hoping that the governments, or the doctors or community workers or organizations like Addis are in a position where we can sort of help a difference with mitigating risk and humanizing people's experiences, helping them to get through it while doing the best that we can to reduce the risk of spread.
Yeah, that's right. And that's I think a really good point to stop at, and just say this virus is showing more than ever that we are only as strong as our weakest link within society, and we're only as healthy as our least well person. So public health is so very important. And I just want to say thanks so much for taking the time to speak with me. It is always a pleasure. You were on a radio program here in Nashville recently, and the reporter said, I just love hearing her voice. She's got such a good voice, and you're also just a lovely person to chat with, because you always have a smile on your face, even in the midst of this. And I think a lot of people could use a smile. So thank you for that.
Yeah. Thanks for all you do, and thanks for reaching out. And we hope that we are all winners